All right, good afternoon, everybody. I'll give it a couple of seconds here while the waiting room is bringing everyone over. It's good to see a lot of familiar faces and names, though. My name is Kelly Talby, Communications Development Coordinator for Kentucky Voices for Health, and we are a proud member of the ThriveKY campaign. It's only been a month since we last got together with you all, but a lot is going on. Since we last saw you all, Omicron is raging through the state at alarming rates, and for especially anyone with children in the home, directly or indirectly, you know what that is looking like right now with school. The holidays seem like a million miles away. We've had historically violent and fatal tornadoes. We had junior tornadoes on New Year's Day. We had a very disruptive ice storm last week. Session has begun. Redistricting has already passed. There is a lot rocking and rolling. So that is kind of a recap of 30 fast days of a lot. Emily, if you want to go on to the next slide. ThriveKY, a lot of you all are familiar with us by now, and what our core purpose means. We want to meet the basic needs of all Kentuckians through both systemic changes, barrier lifts. We recognize that many of ourselves at times, many of our loved ones, many of our neighbors face historic and systemic barriers to just having their basic needs met. For those reasons, we advocate together. This looks like anti-poverty, anti-racist. You can see more details about our shared principles here. And we actually pretty recently gave this another look-see to update it some. Here's a snapshot of our steering committee members. And then a quick plug for our 2022 ThriveKY sponsors. United Healthcare Community Plan has already stepped up, said they want to be a part of this and supporting it throughout the year. And we are going to be soliciting additional support. If that speaks to you and you have the ability to give or know someone who might, if we aren't already connected, we hope to hear from you. Please email me. I'll be glad to get you any information you might need. Here's a quick snapshot of our agenda today. We do encourage you as we go along, if you have any comments or questions, to put those in the chat box as we go through the presentation. That way, if we're able to respond to everything, the entire room gets to hear the answer in live time. And even if we're running short on time, if it's a very busy chat and we run out of time, we will try to put that into a written answer in a follow-up email that everyone will receive tomorrow. This is being recorded, and we will share the link with you as well as an evaluation and any other resources we share today in the chat in that follow-up email tomorrow. Let me see. Yes, just a couple quick housekeeping and then we'll get started. There are always quite a few of us in the room. Try to stay muted if you can. We do love your puppies. We don't need to hear them scream at the mailman if it's possible. We will gladly work with any community health worker or licensed social worker. If you'd like continuing education credits for today, please email me. You can go ahead and email me now, or if you just want to respond to tomorrow's follow-up email, I will try to turn those around to everyone within a few days like usual. And I'll drop my email into the chat if I can find the chat box. And then we can go on to the next slide and get started. So tornado recovery, relief, and resources. We wanted to put into a single place for you all. It's an overwhelming amount of contribution opportunities, assistance for impacted or displaced Kentuckians. This is just a quick, organized few slides that you all can keep handy, and you don't have to dig through the whole presentation. The Team Western Kentucky Tornado Relief Fund, I don't know what its current total is. It was in the double digits of millions last week, but this is the official charitable contribution opportunity for folks to put money that will go directly into the hands of those impacted by the storms in December. The state tornado resources link there, this is organized by the governor's office. The next slide here in a second, you'll see kind of what that looks like. I can't emphasize enough how much information they have put into a single accordion style user-friendly format. The one I screen grabbed here for childcare assistance, what you can't see below there is it continues to go into each county that was impacted, phone numbers, locations, hours that the offices are operable. You got addiction services, autopsy information, if you need a new driver's license, if you need shelter, if you need food assistance. I mean, this thing is chock full. And then you can also additionally offer assistance. If you are working with a program that wants to do more or has a means to do more, there's a portal strictly for you to contribute to this accordion style list. And then what was on the last slide? Can we go back one? Oh, yes. So we are organizing healthcare relief resources and tips. This will be updated with presumptive eligibility Medicaid information. We'll have any open enrollment or special enrollment period updates added to that. And then here is just the main number and link for any survivors you're working with or talking to directly. If they are not getting their needs met and need additional assistance, that is how you can reach FEMA directly. And then I will pass it off to Olivia, who's going to give a quick snapshot on domestic violence resources for disaster relief.
Thanks, Kelly. I'm Olivia Spradlin with the Kentucky Coalition Against Domestic Violence. All of our programs in the western part of the state that are in affected areas are open and operational right now. Kentucky has one of the highest rates of domestic violence in the nation, and we also know that in the wake of disasters, that those rates increase. So if you are working with folks who you know need help, all of our programs are open and have their own 24-hour hotlines. You can find that information at kcadv.org. The National Domestic Violence Hotlines number is also on here. They're open 24/7 and can refer to local programs. And additionally, KCADV has a disaster relief fund specifically for survivors and for some of the workers at our programs that were affected by the tornadoes. If you are working with someone who's a survivor who might need like immediate financial assistance, that could be an avenue for you to be able to get that from them. Right now, the way that is working is that that request would have to come through one of our member programs, which again is listed on our website at kcadv.org.
Hi, I'm Marcy Timmerman. I'm the Executive Director of Mental Health America of Kentucky. Just making a quick plug. If folks a lot of times don't know that there's specialized mental health help available 24/7, 365 days a year with the Disaster Distress Helpline. This is tied into the National Suicide Prevention Lifeline, but it's specifically trained individuals who are answering this who have been through the disasters themselves or have been trained on what to expect to hear from you with disasters. There are unique things, right? There's a lot of grief going on with disasters. Anytime that there's a tornado or a flood, people have lost items, some people lose jobs, sometimes unfortunately we also lose human beings that we love. It's great to have somewhere to talk to if you're really stuck in a place and don't know where to start. Call or text the 1-800-985-5990. You can also go to the website disasterdistress.samhsa.gov, and that is an excellent website. It has lots of resources about what to expect to feel, and how to kind of help other people. If you're an employer, for instance, how to help your employees when they're coming back from all of this, right? What to expect and what things to have in place. So there's just a lot of information out there. We wanted to make sure we highlighted. Next slide. So yeah, this is just some information on grief that I wanted to make sure everyone had. I won't read the entire slide, but grief is different for every person and every single loss. And there are different types of grief, right? You heard me, there's items, there's your home possibly, there's possibly your job, those kinds of things. All of those go through the grief process. And if you lost more than one, you're grieving more than one thing at the same time. And some grief will come out as anger, right? And that's justified too, right? It's not your fault, and what in the world, right? So it's normal to have those feelings, and just kind of make sure that you understand how to help yourself get through it, how to help children get through it. And those in your community, there are some community-based links as well on those pages. So thank you.
Hi, everyone. This is Adrienne Bush with the Homeless and Housing Coalition of Kentucky. And there are some disaster housing assistance resources that we want to talk about. Everybody is likely familiar with FEMA, the federal agency that helps respond to disasters. And you also would likely know that FEMA is on the ground in Western Kentucky, still going through the assessment process. But we wanted to share some of the different types of housing assistance under FEMA's individual assistance program. Many of you know that the Kentucky state parks in the region have made themselves available for sheltering. And one of the reasons that it's a good thing is because it allows people to shelter in non-congregate settings, which is really important in a pandemic of an airborne disease. And then there is also rental assistance available, and home repair and replacement, lodging expense, other things. So we are monitoring the situation with an eye towards making sure that the people who are most vulnerable, who may normally fall through the cracks in a disaster, receive the assistance that they need to move forward. Next slide. Okay, so as I said, most sheltering activity right now is taking place in state parks and motels. The deadline for renters to apply for FEMA's individual assistance program is February 11th. I heard this morning that about 13,000 applications in FEMA's, have been applied to through FEMA's portal. And then the state does plan to procure FEMA eligible temporary housing. This was talked about at one of the governor's press conferences, and then in House Bill 5 and Senate Bill 5 that have been filed in the General Assembly, 15 million would be appropriated through that should those bills pass. And then I also wanted to highlight Kentucky Housing Corporation, our state housing finance agency, has compiled an online directory of available rental homes. This is a portal for both people who have been displaced as well as property owners and managers. We want to try to match people up to where they can go and make sure that they receive the housing that is available. We know that we've lost quite a bit of our housing stock. As I said, folks in Western Kentucky are still kind of in the assessment phase, but in the meantime, this is a great step forward. Next slide. With that, I'll turn it over to Jessica Klein from Kentucky Policy.
Thanks, Adrienne. So hi, Jessica Klein with KY Policy. I'm here to talk a little bit about the disaster food assistance that's available. So the first is Disaster SNAP or DSNAP. It provides non-SNAP households with food loss or damage from disaster with food assistance. We estimate there's about 14 counties that are eligible for that. Applications are going to be due tomorrow. So there's two ways to apply. One, you can do it over the phone by calling the number here, this 833 number. And that number is separate from like normal SNAP offices. It's directly just for DSNAP. So should be able to answer questions there. They're going to be open 8 to 5:30 this week. So again, those applications are due tomorrow. You can also visit in person a DCBS office, and there's a list of the counties and the specific addresses that are open for DSNAP, and those are going to be open again that 8 to 5:30 time. And then there are a few other changes that have been temporarily allowed for SNAP for families that are already participating in SNAP, the traditional food assistance program, supplemental nutrition assistance. So one thing that was provided was automatic replacement of benefits for kind of this 6 areas or counties that were eligible. So those were sent out. If your SNAP household is not covered by that, you can still get a replacement by calling the normal 855 number that you would call to access SNAP information. There's also 21 counties, so again, a larger group that were affected, and they received an extended recertification period and waived periodic reporting requirements for 6 months. So that kind of minimizes the amount of additional paperwork they have to submit to DCBS while they're trying to recover. So that's, you can find those 21 counties. It's again on that, that list of resources that Kelly shared, that website. And then the final piece is a hot food waiver, which basically says families can purchase hot foods that are ready to eat. So like the rotisserie chicken that you see in the grocery store that normally isn't SNAP eligible would be eligible for purchase with SNAP. And that's going to be in 37 counties. And that's to ensure that there's enough retailers that can provide resources, since it's not required that all restaurants or grocery stores provide hot ready foods for SNAP purchase. It's totally optional for retailers to opt into that. So that's why there's a larger group of 37 counties that can accept the hot foods. And that's going to be through, those purchases will be through January 17th. Next slide. On to health coverage.
Hi, this is Priscilla Easterling with Kentucky Voices for Health. So if you need some health coverage, there are still a couple of options that are available. Open enrollment is currently going on right now through the state-based marketplace OneConnect. They actually extended the deadline from January 15th through the 31st because partially because of the disaster and technical issues and things like that. So that is available right now. And then there's also PE Medicaid, which is temporary, but it is always available. Right now, Kentucky allows for 2 PE periods within a calendar year, and each PE period is 2 months, the month of the application and the following month. So you can apply anytime throughout the year. If you're under 65, income below 138%, you can apply it anytime during the year, and that same thing goes for regular Medicaid. So there are options available.
And I think with that, the next is to pass the mic to Dr. Sheila Schuster, who's going to give us a deep dive on the 2022 session.
Thank you very much. And thanks to all of you for putting together those wonderful resources on every one of the kinds of needs that people will have. Just a note that from a psychological perspective, this is going to be a long time coming in terms of recovery. So there are stages of recovery from a disaster as extensive as what we had with those tornadoes. And I think what we're seeing, at least on the mental health side, is that after 30 days, the shock is wearing off a little bit and the reality is setting in, and it's discouraging, depressing, anxiety producing, all of those things. And the immediate needs to make sure everybody's safe is kind of past. And now people are trying to figure out what's my next step. So any resources that can be made available, and these slides will be made available to you. So if you're out and working with any of those folks or their extended families and so forth, I think these resources are wonderful. Thank you for putting them together. So the first week of the session was last week. We opened on the first Tuesday after the first Monday of the month of January. And they extended the first week by adding a Saturday session because they needed the 5 days to pass all of the redistricting maps. So we have new maps for the state House, for the state Senate districts, for the congressional districts, and for the Supreme Court districts. And they were approved essentially on party line votes and have gone over to the governor. They were sent over on Saturday. So if you remember your Civics 101, the governor has 10 days, not counting Sunday, to either sign them into law, to allow them to become law without his signature, which is kind of his way of saying, I really don't like these, but I don't dislike them enough to veto them, or he can veto any or all of them. There was a lot of public outcry, as well as a lot of angst among legislators about the process more than anything, that we didn't get to see these in public much before the session opened. The House maps were released on a state holiday the day before Christmas without the other accompanying documents. The congressional maps and the Senate map and the Supreme Court maps were not released until this past week. So if you tried to look at those maps on your computer, it was literally impossible in the rural and the urban centers to figure out where those districts were. So the process, I think, was not as good as it could have been. Right now, if there aren't any changes, there are 4 districts in which incumbents, those legislators that are already in office, will have to run against each other if they want to run to represent that newly constructed district. So there are 2 Republican sets of legislators, one in the far east, one in the far west. And then in Jefferson County, there are 4 legislators, Democratic women, who will have to pair off and run against each other. And that's creating, I think, some real concerns. Part of this was the filing deadline for individuals to say that they wanted to register with the Secretary of State and declare that they were going to be candidates in the upcoming elections. So that filing deadline had been January 7th. And of course, we can't expect people to register to run if they really don't know what their district is. So they've moved that to January 25th to give candidates time to decide that. If the redistricting is held up at all, either through court action or the time it takes to override a veto or whatever, we could see that filing deadline moved a little bit later. And just a reminder that in 2022, all 100 House seats will be up for election. Half of the 38 Senate seats will be up, and all 6 of our congressional legislators in DC will be up for election. Next, please. So just to give you some context, when we did this webinar last year, when COVID was hitting us and we didn't even have vaccines yet, the Capitol and the Capitol Annex were essentially closed to anybody except legislators, LRC staff, the media. The Annex is open and they are not requiring masks. And you will see maybe, I'd say 40% of the people I saw up there last week had masks on. It's really up to you whether you want to wear a mask or not. I've heard some legislators say that if they're meeting with constituents and others and that somebody asked them to wear a mask, that they will put a mask on. Some of those legislative offices are fairly small. And if you're in there without a lot of ventilation and several people in the room, with Omicron spiking the way it is, it could be unsafe. It's unclear whether any large gatherings will be allowed in the Capitol. The legislators have control over the rules over in the Annex, and the governor has control over in the Capitol. I'm guessing that as long as we have Omicron to the extent that we have it, that we're not going to be seeing the huge kinds of rallies that some of us like to put on, which I think is too bad. We traditionally bring 700, 800 people with disabilities to the Capitol and to the Annex, and it's a great opportunity for them to meet with legislators and for them to be recognized by legislators and policymakers for the needs that they have. The other thing that happens every session, usually the first day or two of the session, is that both the House and the Senate adopt new operating rules, essentially. And we have links there so you can actually read those rules. We're concerned that both chambers have put in some barriers to limit debate. We saw it last week where there was a time limit of 10 minutes, including any introductory comments that you could make in speaking about a bill on the floor of the House in particular. Of great concern to us as advocates who are trying to watch the process and try to follow it and to try to get word out to you all about what's happening is that the House has removed the process of what we call bill posting. And that is the days prior to a hearing where a bill would be listed on the agenda, so we knew it was coming up. So you can imagine if we're all in favor of House Bill 123 and we're waiting for it to be heard in a particular House committee, how important it is to get that 5 days of notice so that we can get our networks geared up to weigh in on this, to contact legislators on that committee, to plan to come and testify on it. So with that out, you have to watch the LRC website like an eagle. We are delighted to have Kelly, who must stay up all night to do these things because she catches so many of them and sends out notices to us. Probably more important than ever that you be signed up with a group that's advocating for things that you care about, because all of us are going to be watching for those bills to come to committee. In the past session, many bills that were introduced were not even assigned to a committee, and they were killed essentially as soon as they were introduced because they had no chance for discussion or action. I believe about 95% of the bills that had Democrats as primary sponsors last session were not even assigned to a committee. Whether they will continue to do that or not, I don't know. But because a bill has been filed does not mean that it's going to have any action. And so we really need to be looking to see whether it's been assigned to a committee. In the Senate, the rule has been changed back to assign a bill to a committee 5 days after introduction. So they are going to assign all their bills. Now, it still doesn't mean that the chair is going to call the bill. For those of you who are relatively new to this, the vast majority of bills that are introduced in a given session do not pass. And it's not because they were voted down. It's because they never got any consideration. So once a bill is assigned to the committee, we need to be watching again to be able to have the chance to weigh in. I would advise you, if you are working on a particular bill, that you educate all of the legislators in the chamber where it's being introduced, whether it's on the House or the Senate side, and make sure they know what this bill is about. If you have a one-pager, that you're going to have a couple of bullet points, that they're familiar with the bill and the bill number, because you're not going to have as much time to do that kind of preparatory education with legislators without these posting rules in place. Next, please. So one of the big issues around health is something that most of the public is not aware of, but there currently is a deadline of January 15th to end all executive orders previously issued with regard to the COVID pandemic. And you've heard in the 2021 session and again in the special session, the Republicans in the House and Senate tried to curtail the governor's executive orders as much as possible. But these are orders that were issued by licensure boards in most cases to allow health professionals from other states to come and practice. In Kentucky, we had a large group, for instance, of advanced practice registered nurses from Tennessee who came over the border in Southern Kentucky and have provided healthcare services that were much needed. We've had psychologists and other mental health professionals from other states, sometimes bordering states and sometimes not, come into Kentucky to provide services. And those have been needed during the pandemic. They're also in these executive orders, sometimes our licensure restrictions are loosened. So we think it's very important that these executive orders be extended past January 15th. And we're watching to see whether that's going to happen or not. It probably is an action that we're going to have to generate some advocacy around. But a lot of it has to do with our workforce capacity during this pandemic. There also have been already a number of bills that have been filed around vaccinations, around masking, about whether you can ask someone what their vaccination status is. There have been bills filed that prohibit employers from making any requirements of employees around either masking or vaccinations. There are all kinds of public health policies that are under attack with some of this legislation. Anybody that's connected with a child who's in public schools in Kentucky knows the NTI issues and the school closures. And while we think that those are dictated by your local Board of Education, actually the legislature is setting some barriers in terms of the number of non-traditional instruction or that kind of online education that the kids are having. We also think that there will be further legislation around the healthcare workforce shortages, particularly in the nursing field. So again, stay tuned through Kentucky Voices for Health or from any of your advocacy organizations that you're already active with. Next, please. So you can still follow the action. We got used to this last session, and that still is available if you don't want to come to Frankfort. They're live streaming either on Kentucky Educational Television or on the LRC YouTube. And if you miss the committee hearing, because those happen between 8 and 2 every day, or Tuesday through Thursday, you can go back and catch those in the archives. I would also suggest that you sign up for the Kentucky Voices for Health newsletter. We'll be sending out analysis of lots of this legislation, sending our alerts that way, and other legislative information. The quickest way to be in touch with legislators, particularly a whole committee, is through the legislative message line. So what you want to do is to take a minute or two and register with them by calling 1-800-372-7181. They'll ask for your name and your home address and your phone number. And then once you are registered with them, it probably doesn't take you more than 30 seconds to get a message recorded by the switchboard and passed on to legislators. So what you want to be prepared for when you call with a message is they will say, what's the bill number? Who do you want the message to go to, and what's your message? Do not read paragraphs to them. This is a group that is trying to field thousands of calls, and they are a wonderful group. I've often remarked, I don't know what kind of happy pills they're on, but they are remarkably upbeat, pleasant, helpful, patient. So when I send out legislative alerts to our advocates, I will say, call the message line 1-800-372-7181 about House Bill 123. Your message, you want your message to go to the House Health and Welfare Committee, and your message is, and it's 1 or 2 sentences. And I think it's really important to do that. If legislators hear that message over and over again, it's very, very helpful. Of course, you can identify your legislators by going to what we call the LRC website. You type in your home address because you're assigned to a district by your home address, and then it will show you the website descriptions of your legislators. Be sure they know you and what's important to you. This is an ongoing relationship, not just a one-time deal. And if you want them to recognize you as a constituent, the other thing I recommend if you're first introducing yourself is to send an email to your legislator and put in the message line, I am your constituent. Do not do that to all 138 legislators or you will lose a lot of credibility, but do send it to your senator and to your representative, be sure to put your home address in there, because they will want to know, for sure that you're a constituent. And then tell them very briefly what it is that you want to talk to them about, or what your passionate issue is. Next, please. I'm going to very quickly give you the highlights of the budget, and then we're going to turn it over to the real expert on the budget. But something happened on Friday that I've been going to Frankfurt for 44 years. I've never seen. I've yet to find anyone who has ever thought that it's happened before. And that is that the House Appropriations and Revenue Chair, Jason Petrie, filed the House Budget Bill, House Bill 1, and he did it before the governor even had an opportunity to present his budget. So that has never happened before, and even in other general assemblies that were of a different party than the sitting governor. So the governor will make his budget address this coming Thursday at 7 p.m. Eastern. It'll be carried on KET. I think it's worth listening to. The budget is really the values document of our state, and that the priorities come in what gets funded. And you know that from making your own budget in your household. The things that are the most important, you make sure you have money for, and then the things that are less important are further down on the list. So the budget process going forward remains unclear because we're not sure what will happen with any of the governor's budget priorities in this already filed legislative budget. There continues to be talk. We have a surplus of $2 billion with a B. There continues to be talk about putting more money into the rainy day fund, which is kind of the savings account for the Commonwealth, or more into pensions. Many of us are working with folks that are suffering because of the chronic underfunding for services and supports in Kentucky. And we feel like we need investments in those people who have been overlooked and underfunded for many years. So it's my pleasure to turn this over now to our budget guru, Dustin Pugel from the Kentucky Center. Dustin?
That's a lot of pressure, Dr. Schuster. I don't know. I work for a budget guru and I play one on TV, but I'm not sure I'd call myself that just yet. Hi, everybody. I'm Dustin Pugel. I'm with the Kentucky Center for Economic Policy. We're a nonpartisan nonprofit research group based out of Berea, and we work on budget and tax issues, as well as economic security and criminal justice policy all across the state of Kentucky, and primarily try and make sure that we have a state government and an economy that works for everybody, especially those at the sort of bottom. So I was tasked with giving a very brief economic update and then moving on to kind of where we are with the state budget. And so I'm going to try and run through these slides as quickly as I can. The first one is just a continuation of the same slide I've been showing for a long time now, essentially showing that despite the rhetoric around worker shortages and fits and starts, there really is a continued steady improvement in our workforce, that people are coming back to work. We've regained about 77% of the jobs that we lost in April of 2020. That means that 228,000, almost 229,000 folks have returned their job, net of those who are retiring and who may have gotten long COVID or have had to drop out for other reasons. At this point, we're only about 3.4% below where we were in February of 2020. So this chart is zoomed in a lot to kind of show you the changes, because if I zoomed out further, you kind of lose some of the detail. But all that to say that we really are moving in the right direction and more quickly than we have in past recessions in terms of our workforce. So let's go to the next slide. So while the economy is not growing in fits and starts, the labor force is growing in quits and starts. And so what I mean by that is that although there's been conversation around the Great Resignation and a lot of people leaving their jobs, which is true, it's not the case that people are leaving their jobs and just staying out of the workforce. It's much more accurate to say that the Great Resignation is more like the Great Finding a Better Job. People are leaving their jobs and then moving into other jobs immediately, which often pay better or provide better benefits or better working conditions. This chart over here on the left shows several different industries. And so the y-axis, the up and down, is basically the percent of people being hired. And the x-axis, the sort of side to side, is the quits rate. And so the fact that all of those industries are above that 45-degree axis means that in every single industry in the economy, there are more people being hired than there are quitting. So that means that people are quitting and moving into different jobs in the same sector or maybe a different sector, plus people are being added to the workforce from outside of it. And that's a good thing. We really want to make sure that workers are able to find jobs that fit their skill sets, that fit their lifestyle, that pay well, that provide adequate benefits. Economists call this labor market mobility, and generally speaking, it's a really good thing. The private sector is responding to worker needs. Folks have heard a lot about rising wages and employers who are willing to work with folks on their schedules. And ideally, we're moving away from things like just-in-time scheduling, which could call people in sort of at a moment's notice. And this rise in wages and employment in combination with increased federal spending means that the state has gained a lot of revenue. So let's move on to the next slide. So I almost never correct Dr. Schuster, but in this case, I'm going to just say that a $2 billion surplus is true for the upcoming fiscal year, but when combined with the current, the fiscal year that just ended, it's actually going to be closer to $3.4 billion that we will have unallocated. We don't know, that's not appropriated for anything. And unless they do that, all of that would end up in the rainy day fund, which would be nearly $3 and $10 that we spend each year. That is far, far, far more than we need. And just to give you all context, this chart shows the percent of the general fund that the rainy day fund has made up over basically since it was created. And it has never exceeded 5%. And yet currently it's sitting at around 12.5%. If none of it goes spent, it would be just a massive amount of money. But as folks have said already, it's raining now, and there is a lot of need both inside and outside of state government. We have a very long backlog of needs. And so we think, and this seems to follow best practice elsewhere, that starting out with 5% is good. And then we should spend the rest of that on these needs that are very pressing, and work our way up to a 15% rainy day fund eventually, so that when the next recession hits, and it's averaged about every 8 or 9 years over the last several business cycles, we're ready and we don't have to cut services. So let's go on to the next slide. On top of the $3.4 billion general fund surplus, we're going to have an additional $1.1 billion in federal funds that we'll need to decide how to spend through the second round of the ARPA money that goes directly to the state. So that money is really important. The last round we used for things like repaying our unemployment insurance loan, improving broadband access, making very long needed improvements to our water and sewer system, and then also improving our ability to respond to COVID in congregate settings. But we're going to have another $1.1 billion to decide what to do with. And there's been conversation about how to spend that money. We really think that the things that the US Treasury has highlighted are a good way to go. So one would be bonuses or hero pay to essential workers. Another would be to prevent cuts to essential services that was caused by pandemic-related revenue losses. And then also additional investments in water, sewer, and broadband infrastructure. This money is, it is a huge amount of money. It has to be obligated by 2024, so the legislature doesn't have to decide what to do with all of it this session. They can decide what to do with it in future sessions, but it all has to be spent by the end of 2026. So in a $3.5 billion general fund surplus and a $1.1 billion ARPA allocation will all need to be at least considered this session. And that really opens up a lot of opportunities. So let's move on to the next slide. Our state budget, won't be a surprise to anyone, really, like Dr. Schuster said, is a statement of our values. And so if we look at it that way, then what we value as a state are things like education and healthcare primarily, and then secondarily, the criminal justice system, and then human services. And human services is not a technical category, it's sort of a lumped set of categories that includes things like behavioral health, the Department for Community-Based Services, public health, aging and independent living, really mostly just the non-Medicaid portion of the Cabinet for Health and Family Services, which we talk about so much during these webinars. The rest of the spending that we have includes things like agriculture, the constitutional offices, including the Attorney General, Secretary of State, Treasurer, and Auditor, the Energy Environment Cabinet, the Labor Cabinet, Workforce Investment and Education Cabinet, and several others. So all said, the majority of our spending goes to education, whether that's P through 12 or post-secondary education. The next largest single appropriation is Medicaid, and then the rest are just sort of split between a lot of things. So let's move to the next slide. And while we allocate a large amount of money to healthcare and education, and it is a $12 billion budget, the reality is that we are at the tail end of a very long set of budget cuts. There have been 20 rounds of budget cuts since the Great Recession, both in terms of actual dollars and also inflation adjusted dollars. One area that we make a very large investment in, but has been shrinking over time, is K through 12 education. And so, this is sort of outside the wheelhouse of what we normally go over, but I think it's a good example of what's been happening across state government. If you look at the per pupil funding for K through 12, it's down 26% compared to 2008 when these cuts started. But other areas that are really important to us have also been either cut or frozen. So the waiting list for Michelle P. and SCL waivers has grown over the last 10 years. It's over 10,000 folks now. Social workers are in dire need of both raises and extra help. So we know that they are burning out and turnover is extremely high. The commissioner reported back in August that 44% of social workers have had less than a year of experience, which means that there are supervisors of other social workers who have just barely started themselves, having 2 or 3 years of experience. Public defenders are quitting in droves. Dozens quit last year, and they're not being replaced fast enough. So their caseloads are becoming extremely high, and they have a constitutional duty to provide adequate legal services for Kentucky's indigent defendants. And so that's leading to filling up the jails, and that's leading to plea bargains that add records to folks. And that's creating a lot of difficulty for counties who operate those jails. Public health has been straining to keep up with community need even before COVID. I mean, folks may remember the hepatitis A outbreak, and that was really difficult on public health departments to make sure that they were adequately assessing what's happening in restaurants and in other settings. When COVID hit, it was just that much worse, even with federal spending, because that federal spending is temporary, but you need permanent long-term staff to be able to do that job well. And I think what's really important to consider across the board is that there's only been 2 raises of any kind for state across the board raises of any kind for state workers over the last 12 years. That includes cost of living adjustments. I'm not just talking about sort of like performance raises or anything. If you started in a position in state government and you haven't moved out of that position 12 years ago, your income is only about 2% higher than it was when you started, even as inflation has risen dramatically. So let's move on to the next slide. We just came out with a report today that really drills down on this problem. And I'll put a link to the chat here in a little bit, but public sector wages have stagnated over the last 12 years. And that's even maybe being generous. So when we know that in 2010, total compensation for state workers was lower than it was for private sector workers, which is no surprise. We hear that all the time. What's concerning though is that since that time, actually since 2008, which is when the raises effectively stopped in state government, state salaries have fallen 4%, but private salaries have increased 13%. And that masks what it looks like for executive branch workers, which is the vast majority of state government workers. Their salaries have fallen 6.2%. At the same time, we've done things like end a full pension system. We have worsened health benefits. We've allowed unfilled vacancies to stack up so that the workload has been shifted onto other existing employees. That's not just bad for morale, that's really bad for the provision of public services in general. So what we have is a burned out workforce who's not being adequately compensated and is looking over at the private sector where they can earn more than they're earning in their current jobs with similar benefits and probably a better job quality. And that is not the fault of sort of state agency managers. That's the fault of the General Assembly that has allowed this to happen over the last 12 years. So what that means is that the executive branch has 18 and a half fewer employees than it did 10 years ago. There are 7,000 full-time positions out of 33,000 that are unfilled right now. Turnover has become a massive problem. I already mentioned social workers, but this is true in a lot of other places, including DJJ, where in 2017, they hired 150 new youth service workers to work in the youth detention facilities, but they lost 180 that same year. And while there is a statutory 5% increase that's supposed to happen every year for state workers, which would cost about 163 million, that is far behind what is needed just to make up for the losses that we've seen over the last 12 years, let alone inflation over the last year, which has been about 6.5%. So let's move on to the next slide. What will not help that situation or any of the other significant budgetary needs that we have is shifting away from an income toward a consumption-based tax system. So there's been conversation about this. I'm sure we'll see a bill or two before the end of the year. But just as an example, moving from a 5% income tax to a 4% income tax, which is something that's been discussed, would require increasing the sales tax from 6% to 7.5%. Now, that's only if they want to make up the difference in revenue. If we do that, then obviously there's going to be an equitable distribution for folks based off their wages. Essentially, poor people will pay more and millionaires will get a tax cut. And at the same time, though, we know that sales tax grows slower than income tax, especially as folks who are the top 1% of earners, their income is growing very rapidly compared to the rest of us. And so what that does is it erodes our ability to pay for all of the things that we care about in state government over the long time. And ultimately what we need to be focused on is not trying to give tax breaks to wealthy folks, but finding ways to reinvest our large surplus into our state workforce, into our public services, and make sure that we are taking care of everybody. So I'm going to stop there and hand it over to Kara.
Hi, so what we've got going on, I'll bring you what's sort of going on in DC and what you need to know about. And what's going on in DC right now that is kind of exciting, but we don't have all the details. Emily, you can flip the slide there. is we have at-home testing updates, just without details. So I'm sure you all know that it has been kind of difficult to get your hands on some tests lately, long waits in the state drive-through lines, but those resources are still available. There is still free public available testing in Kentucky in lots of different locations. But the at-home stuff, the White House has put out an announcement that they are going to have a website available hopefully later this month where people can request 500, one of the 500 million tests that are going to be made available that way. And then also the White House has directed private commercial plans to cover 8 at-home tests per person per month. Now the details on that are scant. So we don't know exactly how that's going to work just yet, and the devil's in the details. So we will be sure to keep you updated, and it'll be in our newsletter. But I thought it was important enough just to get the word out there that the door has opened, at least, to having a plan for testing. And then past there, we are still stuck in limbo. We are stuck in limbo where we are still waiting on Build Back Better, and we are sort of just trapped there. And in fact, the leader of the Senate has moved the conversation away from just the drumbeat of we must pass Build Back Better to talking about the filibuster and changing the filibuster so that voting rights can be passed, and perhaps then other bills, including Build Back Better, could be passed, but talking more directly about the voting rights bills that are proposed. Now, what happens? You can go to the next slide. What happens when Build Back Better does not pass? Coming up in just a few days, child poverty will increase in Kentucky 80% because the first missed payment of that child tax credit is going to be in just a few days on January 15th. So families have been getting this monthly payment that has raised so many children out of poverty in Kentucky. And now those children are going to fall back into poverty because we have not kept those child tax credits going. And then what do those child tax credits mean? What do they look like? Go to the next slide. You should go to the next slide, because there's still going to be, parents are still going to get, this actually turned out where we have here the 49%, that was a plan ahead. And now we know it's even actually more than that. So it was even bigger than we anticipated. It was sort of like the same thing with Medicaid expansion when it turns out there are even more people eligible than we had even estimated. The estimate here, again, turned out to be even better, that it helped even more children in Kentucky. So we need to, those children still need that money. Those families still need that money. So we still do want to keep the pressure on to say pass Build Back Better. It's just short by a couple votes in the Senate. And those 2 votes could be our senators. We have 2 senators who have not pledged to support Build Back Better. And if they decided to support it, it would become law. You can go to the next slide. You can go to the next slide. That's what we need to keep. We still need to pass it. We need that investment for Kentucky. We need to address the longstanding inequities. And this is like one relatively easy way to do it and it'd be a big deal. Next slide. But unfortunately, we have made no real movement. There's been just conversations, but it's still just sort of trapped in limbo. It has passed the House and we wait. Who to contact? Hopefully it's the next one. Keep going. Here we go. Here are our 2 senators. And again, if they decided to support it, then it would become law. So call the local offices. It's often much easier to get in touch with someone in the local office and talk to them in person. Say, hey, we still want this. We don't want more Kentucky children to be in poverty. That is completely preventable. That is a policy decision. Children do not have to suffer. Families do not have to suffer in that same way. Just pass this law and that will fix it. That will fix that part of it, which is a really, really big deal. And also, if you're going to get moving forward on some of this other legislation, they're going to need to make some better decisions about that. So bring that up, ask them to do their jobs and pass good policies, especially Build Back Better. And now we're going to hear from Adrienne Bush. I knew because she went off mute.
And here I am. And I just want to echo everything Kara said about Build Back Better. Somebody asked me what happens with housing if Build Back Better is not passed. And I mean, the answer is, how's that working out for us right now? Not great. So we need it. All right, so as a refresher, as the weather gets colder and more drastic, we start to see a lot of inquiries around homeless assistance increase. And I just wanted to highlight, we do maintain a document. It's not pretty, but it's functional. is linked on our website that provides the homeless assistance provider to the extent that they exist by county and by ad district. All right, and then secondly on this slide, as many of you know, there is an annual point in time count of people experiencing homelessness. This was set in Kentucky for January 26th. I believe in Louisville it still is. Not sure about Lexington, but the rest of the state will be doing its count on February 23rd, the last Wednesday of the month. Next slide. All right, update on rental assistance. All of the portals are still the same. Rent relief is still available in counties, and most counties, and can be paid directly to the tenant if the property manager or landlord does not want free money from the government. Next slide. Here is a month-over-month spending trend line that we put together that kind of tells us where we are with Emergency Rental Assistance 1.0 in the balance of state and areas outside of Louisville and Lexington. That is called the Healthy at Home Eviction Relief Program. And you can see where the state has subgranted additional money to Louisville and Lexington to try to make sure that they get the resources that they need. And you can see that there is still a substantial amount of money left for Kentucky renters and their landlords. Next slide. Here are the eligibility criteria. Again, it's pretty generous criteria. If you're below 80% area median of the area median income, and quite frankly, that's a lot of people and most renters. And it can provide a maximum of assistance of 15 months. Next slide. All right, the Housing Assistance Fund. This is the fund that will help people who are behind on their mortgage. And in an update from last month, we are now on step 4. The program build is pending. Because Treasury has issued feedback based on Kentucky Housing Corporation's draft plan, and so now they're incorporating it and hoping that they can open the program soon. I know that this has been a long time coming and people are anxious for this. With that, that is the housing update, and I will turn it back to Jessica.
Thanks, Adrienne. So I'm going to provide a quick update on both the SNAP and Pandemic EBT or PBT food assistance programs. And as you all might know, Kentucky still ranks 8th in terms of food insecurity, so not doing great. And as you can see here, that's reflected in our SNAP participation data. There's a little uptick at the very end. And we know that there's over 528,000 Kentuckians participating in SNAP as of November. So those numbers are still coming out for the winter, but yeah, the uptick is happening again at the very end there. Next slide. So a few things that have been continued federal supports for SNAP. One is the SNAP emergency allotments. You'll also see them sometimes as SNAP EAs or SNAP max allotments. Those are the benefits that have gone to every household to bring them up to that maximum household level throughout the pandemic. That has been approved for January, and I think most of that has been sent out with a few delays because of the holidays. And this is one it's dependent on one of the executive orders that Sheila talked about, which is the Public Health Emergency Declaration, which is due to end January 15th. So without action from the legislature, that might mean the end of SNAP EAs. There's also a few other things that the Department for Community-Based Services could do in terms of requesting that waiver from the USDA to make sure that we're still eligible and still receiving those emergency allotments. So for now, we are still approved for January, and will always be approved for an additional month to make sure that that's not an immediate drop off for people. So that means we're approved for February as well. So we'll have updates on when that'll be coming up soon. I'll also say that another thing that's dependent on the federal public health emergency declaration is the new requirements for low-income college students to participate in SNAP. And that will also see a 30-day delay. So as long as we still have a federal public health emergency, then those additional college students will also be eligible for SNAP. And I'm seeing a question in the chat that's asking who qualifies for emergency SNAP benefits. So for these emergency allotment benefits, that's all SNAP households should see an increase to get to that maximum benefit amount if they weren't already receiving that maximum benefit amount. So a few other reminders related to SNAP. Just want to mention that recertifications are still going on. Those started again last April. And so you'll receive a notice before your recertification is due. You can complete that interview over the phone, and documents can be submitted some different ways than usual. They can do it online through Connect. It can be mailed into Frankfurt, or there's also a fax number that you can send that to. So as a reminder, stimulus payments, UI payments, and child tax care credits don't count against you in SNAP. So if you have questions about your recertification, or you're not sure when your recertification is, you can call the SNAP hotline here, the 855 number, to check in on that. Next slide. So pandemic EBT, as you all might remember from last school year, pandemic EBT, or PEBT, provided grocery money to families with kids. And the goal of the program is to help those who weren't receiving free and reduced meals in school because their schools were closed due to the pandemic. Towards the end of the school year last year, that was extended to families who participate in SNAP and have kids under 6. So that's an additional group of people who were eligible, and they received benefits over the summer. And then kind of the third wave we saw of pandemic EBT last year was over the summer. We had an additional payment of $375 per student to cover missed school meals and that child care group over the summer. So one thing to mention here is that we are working on the application for this school year, and I'm going to go into that on the next slide. But also, if the Build Back Better plan passes at the federal level, we will see a more permanent version of the summer EBT program, which would be similar to this, where families would receive additional grocery money called summer EBT if they participate in free and reduced lunches over the summers. So that's something we still want to see pass, so that those families can help reduce summer hunger that we see in Kentucky. Next slide. So for this school year, our plan has officially been submitted to the USDA. We're not behind, only a few other states have sent theirs in. So ours has been sent in now. And what that means is we'll have new updates soon once that plan is approved by the USDA. So they have to approve our plan. They go through a back and forth with our Department for Community-Based Services on what the plan looks like. Again, it'll be a similar group of people, but the way that it's implemented will likely be different because of the way that kids are missing school nowadays is a little bit different than it was in the past. So we'll have updates on that soon. Next slide. Just one thing I wanted to mention was that if you do have a pandemic EBT card, to keep that card, just in case we do end up putting them back on your pandemic EBT card, don't go ahead and throw it away. Keep that in your wallet. And when we have those updates, you'll know if you need to continue using that card or if you need a new card. Okay, and on to the next slide. I'm going to turn it over to Priscilla. Thanks.
Thanks, Jessica. Hi, everyone. I am Priscilla, again, Outreach Coordinator for Kentucky Voices for Health, and I'll be going over some health coverage updates. So right now, we are still just waiting, but we do expect to hear that the federal state of emergency will be extended another 90 days. Again, the Biden administration said that they'd give us a 60-day heads up. That would have been mid-November. It's January, so we're just waiting for that basically any day. For Medicaid, they're just a really good reminder, there should be no copays. No one on Medicaid should be paying any copays whatsoever. If you are, definitely reach out and report that to us, because we do need to report that. And for all insurers, there are no out-of-pocket costs for COVID-19 vaccines, whether you're insured or uninsured. Omicron is big and it's ripping through Kentucky very intensely. So if you haven't gotten vaccinated, please go do that. Please go get your booster. It's more important than ever. Next slide, please. Okay, so there is a couple of updates for open enrollment. Medicaid is always open for enrollment. So you can head on over to connect.ky.gov and you can apply and enroll in Medicaid year round. If you are under 65, your household income is at or below 138% of the federal poverty line, you can apply anytime during the year. So do not hesitate. There's also currently the marketplace open enrollment. That deadline was originally for January 15th, but thankfully the cabinet extended that to January 31st. That's as equally in response to the disasters, the high volumes, and just some technical issues that have been going on with Connect. So thankfully, the really great upside of having a state-based marketplace is that they were able to respond to that and make that change. And so now they were able to extend that to the end of the month. If you apply before January 15th, your coverage date will start February 1st. If you apply between January 16th and January 31st, your effective date will be March 1st. So if you need any help with any of that, if you have any questions, anything like that, feel free to reach out to a connector. We are always here, always around to help you walk through the application process and answer any questions that you have. Next slide. Here are all of the available MCOs for Medicaid for 2022 and more details about their extra benefits. You can follow any of those links for more details about each specific MCO. Next slide. For the marketplace, as we've said, there are 4 new medical insurers available on the marketplace. A total of 4. Most regions have at least 2. There are a couple of counties that only have 1, but most have 2 or more. Next slide. And just a reminder of the incredible savings that ARPA provided. The increased subsidies have been incredible. That was passed last March, and they're only in effect through the end of this year unless Build Back Better passes. If it passes, then these increased subsidies will be permanent. But right now, this is currently the last year that it's technically available. So please make sure that you're going out to shop. It has never been cheaper to go through the marketplace and get a plan. So definitely check it out. Next slide. And in fact, Kentuckians are taking advantage of these increased subsidies. So just really think it's cool. As of last week, more than 73 members were enrolled in a qualified health plan. 60,000 of those members had payment assistance as well, and more than 7,000 new members enrolled in a QHP with payment assistance since November 1st. So in just over 2 months. Since the Connect relaunched total, more than 26,000 Medicaid and QHP applications have been submitted, and there have been more than 164,000 total visits to Connect Healthcare. People need health coverage. They're going out to the website to check it out, which is very cool. And just for a snapshot in time, as of last week, January 4th, there were 32,000 logins on the Connect Healthcare health coverage site. So just really cool. Fellow Kentuckians are definitely checking out Connect. We know it hasn't been as seamless as we would have wanted for everyone, but they have a lot of great information, a lot of great resources, and they're working to improve it every single day. Next slide, please. And as always, PE is still available. There are, as I mentioned earlier, you're eligible for 2 PE periods within a calendar year. That's 2 months of coverage for each period. That's the month of your application, and then the following month. And so you can get a total of 4 months of coverage through PE within a year, and you can apply year round. It is a publicly facing application, so I've linked to it there, and you can find it and apply anytime. And it's a super quick application. So next slide, please. Okay, as I mentioned, Connect hasn't been as seamless as we wanted. The relaunch hasn't been. It's been great for a lot of people, but there have been a couple of issues. Some of the commonly reported issues have been eligibility determination issues with Medicaid, the website just being slow or glitchy, performance incidents, and in the Connect benefits part somewhere in your application, it just glitches out. Last week, there was a big thing of people receiving an access denied message. The payment assistance, the tax credit part, the termination errors, application errors, accessing your Kentucky online gateway account or like the Connect account part, and just uploading documents. Most of these issues have been resolved. If you have received any of these issues, if you're having any of these issues when you're going through, please let us know, or please reach out to a connector. There is an agent issue connector, agent connector issue reporting tool that all connectors and agents can use to help report these issues, to make sure that HPE is working to fix specific glitches and problems that people are having. So if you're running into any of these, do not give up. Don't get frustrated and quit. Reach out to a connector and we can help walk you through this whole process. One current incident that I did want to make sure to highlight for people, CareSource, there have been a couple of problems with CareSource plans being effectuated, meaning people have enrolled in a CareSource plan, and somewhere between CareSource and Connect and CareSource, it's not getting passed through. It's not actually being affected. And so KHB, who is over Connect, they're currently working with CareSource to solve that problem. If you have any questions or if you fall into that, again, please reach out and let us know. They are working to fix that as soon as possible. And then at the end of this month, KVH, we're going to be launching our own public Connect reporting tool for the public to report any issues that they're having. And that's just so that we can help make sure that we're tracking and following any of the issues that maybe aren't being reported through the agent connector issue tracker. And we can make sure that those issues are being resolved as well. So yeah, next slide. So new fun legislation, the No Surprises Act. So this went into effect January 1st, and it's a new law to protect consumers from surprise bills. Next slide. So prior to the No Surprises Act, a really common practice, say, for example, you started feeling some pain, you went to the ER, and as it turned out, you needed your appendix out. The ER you chose, you specifically went to the hospital because you knew it was in network with your insurance company. You go in, they do scans, they give you anesthesia, they do the surgery, you come out all fine and good. But then on the other side, you start receiving extra bills outside of the hospital for specific services, like anesthesiologists for radiology, things like that. That was really common before. Now the No Surprises Act puts a stop to that. Next slide. So now for consumers to get their insurance through any employer at any level, through the state-based marketplace or through individual health plans, beginning January 1st, it bans surprise billing for all emergency services. So if you have an emergency service and you go to any provider, even if they're out of network, and it's an emergency, it has to be covered at an in-network rate without requiring prior authorization. They also ban balance billing for some of the out-of-network cost stuff for emergency services and certain non-emergency services. So basically your cost is what the in-network cost is and not a separate out-of-network cost. Excuse me. Next slide, please. There are a couple of additional protections for insured consumers. There's also no balance billing for ancillary care like anesthesiologist, or if they had to call in an assistant surgeon or radiologist, things like that. It all has to be at the in-network rate. And it also bans other out-of-network charges and balance billing without advance notice. There are also protections for uninsured and self-pay consumers. So providers and facilities have to provide a good faith estimate where they before an item or before a service is scheduled, they have to offer an itemized list with a good price and give you their best good faith effort. And if you are charged if your final bill is more than $400 higher than what your good faith estimate is, you can dispute it. So that's just an additional protection for you, whether you're self-pay, uninsured, or if you are insured as well. Next slide. So it is now in effect. It started January 1st. If you have any more questions, if you have any want any more information about it, definitely go to cms.gov and check us /no surprises. They have a great comprehensive list of resources and information about that. Next slide. And then for maternal health, just wanted to remind everyone, so ARPA last year, when it was passed in March, it provided a state option to extend Medicaid postpartum coverage from 60 days to 12 months postpartum. We will be releasing a letter in the next couple of weeks, a sign-on letter to urge the cabinet to take up this option. So keep a lookout for that. And then there have been a number of maternal health bills that we're keeping an eye on for General Assembly. So make sure to follow our Health Justice Tracker, follow our newsletter for any updates and more information about that. And with that, I will pass it off to Marcy. Thanks.
Thank you. Again, I'm Marcy Timmerman from Mental Health America of Kentucky. Go ahead, next slide. So one of the big things you're going to be hearing about in Kentucky's General Assembly soon, hopefully, will be buzz about 988. What is it? It is a number to call. It's someone to help. That is the big thing. It is a mental health. It's the National Suicide Prevention Lifeline that currently exists. That number is 1-800-273-8255. I don't know about y'all, but I will never remember that entire number if I didn't use that number every week or so. I say it a couple of times a week, but otherwise I wouldn't have that memorized, right? 988 is so much simpler. And we are transitioning to 988 for that phone number on July 17th, 2022. It's happening, whether we fund it, whether we do all the things we're supposed to do or not, that's gonna be there. And that's really good news for Kentuckians. We want to make sure that folks understand their mental health crises can happen to anyone, right? You don't have to have a flood or a tornado to be in a moment, right, of crisis. So, and there is no race, economic, health benefit, any of those kinds of places where mental health is exempt. Mental health crises happens to literally anyone, any color, any economic status. So the 988 number is going to help every Kentuckian. One of our goals with 988 was to not just have a phone number and the same system that we always had. The legislation that was unanimously passed by the Trump administration, it was the only piece of unanimous legislation passed through all the levels, and it was completely unanimous. So that legislation actually outlined us creating a better system for mental health crisis. And that's the most nonpartisan thing I could ever talk about, I think. I don't think any of us wants to be alone or to have sirens at our house when we're just having a mental health problem, right? We want an appropriate response. We want, if someone is needing therapy, right, like that we get them to a therapist right away. We just need a better response to that. And so the 988 process is not just a phone number. Ultimately, it'll be people to answer the phone, right? Right now, we have a lot of increase in calls. We have an increase in severity of calls ever since the beginning of the pandemic. We don't expect that to fall off for another 4 to 5 years, if it ever does, because people are finally accepting the fact that we have mental health, right? Because of the COVID pandemic, more people are talking about it and reaching out for help. So we know that the increase in calls is going to probably continue or at least level off in the next 5 years, but it's definitely going to increase. Yes, mental health care is healthcare. Thank you, Kelly. So people understanding that though, right? We're talking about it more openly in all of our communities, I think. And so we know that that actually leads demonstrably to an increase in calls. And the severity of calls has increased a lot. We've got a lot more youth calling in with severe things, but the majority of those people who call only need to talk to someone. We don't need to have a lights and sirens response, right? 96% of cases, we don't need lights and sirens. We need next day appointments. We need providers to be available, right? We need someone to talk to right in that moment and to keep you safe until you can get in the next day, those kinds of things. So just keep that in mind. If you do need 988, it is there. Most places in Kentucky, it will actually reach already, but it won't technically be live till July 17th. So go ahead and get the next slide. So We are doing an advocacy push to fund 988 here in Kentucky. Part of that Trump administration legislation was asking states to fund a portion of it ourselves. We're looking at a 70 cents per line per month fee to cell phone bills in Kentucky. So $8.40 a year for each Kentuckian who has a cell phone per cell phone line. So if you got a family, I know it's more than that. I know it's not nothing, right? But what that fee will do is it's not a tax, right? It's not in that budget discussion. And I think that's really important. A fee is very narrowly appointed just to 988. It can't be used for other things. And that's why we're asking for it to be a fee. They will be slated to support hiring the people to answer the phone. And the reason we want to do that here in Kentucky, right now, our phones in Kentucky are about 80% of our calls are answered by people in Kentucky. So it's our community mental health centers on the ground who are answering the phone calls to the national line. And we've found that since we've increased that number of people who are being answered locally, they're getting better help. They're calling less frequently. They're showing up the line, getting the help they need. And that's really important. Also, I don't know anyone in Eastern or Western Kentucky who is in a rural area who wants to talk to someone in New York City about their mental health issues. I really don't think that anyone in Miami is someone they want to talk to, right? And those are our two big call centers nationally. So you will get answered, right? But you won't always get answered in Kentucky. If we get 70 cents a line, we'll be able to answer them in Kentucky pretty much at 99% once we get the staffing up. So that's really important to note. And I think that's a really big thing. Please go to the website, fund988ky.org, sign up for information on it. We'll send out emails. As soon as the bill is filed, we will be telling you all how to shout from the rafters and make this a big issue. Next slide, please. I always want to plug our screening. If you are concerned about your mental health or the mental health of a youth or other person around you, our screenings are free. They are a great way for you to get a clinical tool to kind of help you assess how severe this is and get some also DIY tools at the end. You can find things to help you with some negative thoughts and stuff in between. If you need a therapist, right, we can help you connect with one as well. So I just want to always plug those. We are seeing an uptick in anxiety and depression. The biggest reasons folks are taking our screenings right now: loneliness, relationship problems, past trauma. Those are the things that we're getting as responses. And I'm not shocked by that. I don't, anybody else is either. Next slide. And then we always want to make sure that we have all of the crisis line information available for you. Again, that 1-800-273-TALK is the National Suicide Lifeline. There's a crisis text line. A lot of folks don't know that you can text 741-741. Any word you still try to find someone to interpret right away. And then Trevor Project is there for our LGBTQ youth, anyone under age 25. And if they're over 25 and they call, they're going to get them to the right place. I think that's it. Next slide. Yep. Give it over to Kelly.
All right, folks, we are at time. So I am not going to go through each of these slides. For anyone who is new with us today, please know that these resources slides at the end of the presentation that you will receive in an email tomorrow have on this page, you can see our scheduled dates for the year of the remaining meetings we plan to host, our Advocacy 101 training. And again, please email me if you have not yet already. A couple of you all popped through earlier if you need continuing education credits, and I'll work with you in the next couple of days to get those certificates to you. Please stay safe in the days and weeks to come. I hope it is less eventful in the next month than it has been in the past month since we saw you. And we will see you in February, where it will be a CHFS quarterly format as opposed to the monthly series we have here. So please join us when we meet with Cabinet leadership on February the 7th. Talk to you soon.